that is osteoarthritis, called aging process, osteoarthritis changes. This is one of the most common disease of the joint and characterized by multifactorial pathogenesis, resulting pain and joint functions. So it cannot, over a period, it can't be, maybe initially it can be used normal function, but after some time, if you're not taken care of properly, it will go for the severe disability. So osteoarthritis considers a leading cause of disability and associated with high socio-economic burden. Okay, it is not only for our country, throughout the world. In 2020, 7% of the global population was affected by osteoarthritis changes. Okay, the ranking disease 15 regarding the year lived in the disability worldwide. Okay, the risk factors are maybe divided into subgroups. One is actually patient-specific risk factor, that is patient maybe aging process. As the aging process can lead to changes, and as well as gender, that be some patient immobilized, or patients having or obesity, or sarcopenic obesities, and genetic factor and diet. These are patient-specific risk factors, and joint-specific risk factor. That is one the particular joint, like because abnormal loading of the weight, because obese patients, the joint, particularly movement joint, will be our knee joint. And trauma, there is an injury. The injury occurs, that particular areas may lead to early osteoarthritis changes, or sometimes malalignment. Malalignment, there is a joint will not be in the normal position. It can be disproportionate to the alignment. So these are all causes can lead to the osteoarthritis changes. Most important factor also, there is reduced mobility. Sometimes you continue the patients lying down, or due to some reason, you can go for some amount of osteopenia and sarcopenia that leads to changes of the early degenerative osteoarthritis changes also. So pathophysiology is not most commonly is the involvement of that osteoarthritis changes related to articular cartilage, that is in between the bone, what is called that, like a sound it's cushion. That cushion is called cartilage. Okay. The cartilage is the main, the collagen substance mainly in aging process occurs. Okay. Okay, that is the most commonest cause of the early osteoarthritis changes. So, but advanced imaging like CT and MR imaging or other studies have shown not only the cartilage but also the menisci and ligament also that some damage due to degeneration because of weight bearing that leads to changes. Okay, synovium, that's around the sheath of that is the covering of the joint capsule called synovium, that also inflammation that leads to changes. Subchondral, that really the bone changes can occur, leads to muscle atrophy and changes. Recent studies have shown the subchondral bone, okay, critical role of subcortical bone in osteodevelopmental progressions occurs. Okay, the subchondral bone loss early in changes to formation of sclerotic, and this become more bone formation and producing disability. Okay, this is a X-ray will be best modality. Okay, because the primary modality is X-rays. Okay, the X-ray also will show about the very early changes. It can show that early changes like this first stage, it's nothing normal. But as the point option and so this is a grade 1. There is a joint space, maybe subtle joint space may be narrowed because that is in between the joint. That's called joint space narrowing. The joint space narrowing may be very subtle. Once the disease advanced, the joint space much more narrowed, and there is some amount of that margin, maybe some kind of sclerosis that become more brighter areas, and become the joint space maybe more progression and produce reducing and become that cushion effect, or maybe that in between the menisci and the cartilage will be complete damage. The bone will be attached. So bone become articulate. That's why the severe pain, and severe pain leads to changes occurs like that what is called degenerative osteoarthritis changes. Okay, because there's formation of this formation, that bone growth will occur either side. These changes occurs. This joint most commonly occurs in the medial compartment. There is a medial compartment that is the more aspect in the center of the point, and then the lateral aspect. But it can be demonstrated by various methodology, but usually the X-ray to be taken like an erect posture, that we know a standing posture, that will be easier to early make up the diagnosis of the whether patient having normal X-ray or maybe is going for osteoarthritis. We can interact with our colleagues, orthopedic colleagues, then we can do that service. Okay. Apart from this one, if you do a advanced imaging like MRI, if you do MRI, there's not only that the ligament, the menisci, the most important thing, meniscal degeneration occurs. Once the meniscal degeneration occurs, there will be producing some amount of tear, wear and tear of that menisci. Menisci there will be various type of tear, oblique tear, vertical tear. There all will be leads to changes. Okay. So this is a cartilage mapping. This is a normal appearance in cartilage in the pathological process, but I will not go into detail. But MRI will show about the cartilage. The most depicts exactly the cartilage, how much cartilage thickness, and the normal cartilage. This is a look at normal cartilage. The cartilage, it can go for as the aging process. There is various type of changes occurs, like fissuring and thinning and become completely tired. Okay, so these are all changes. Actually, new advanced studies you can make out that meniscal early changes of that cartilage defect and cartilage fissuring, cartilage thinning, and partial cartilage loss or maybe complete partial cartilage loss. Depends on the stage where you can make up that and you can interact with the patients and the clinicians. So thereby they can do the procedure according to them how the severe the disease process. Okay. So the quantification of the cartilage, now we come what is called cartilage mapping. We can make it how much of cartilage will be damaged, the percentage. We can make it the cartilage by the color coding mapping. Okay, that because the MR will be very, very sensitive to pick up that particular things and can make out that cartilage mapping. Okay, this whether medial compartment, lateral compartment, or maybe other joint can be made out by doing this particular technique. So this is very advanced technique we are doing. Our hospital having very good high resolution MR scan, but 3 Tesla, and we can make out the cartilage mapping very clearly. That will be one of the best in our country. We can make out that disease process. Okay. So once the cartilage mapping may be done and we can quantify accordingly the joint preservation procedure can be done. Okay. Once that study may be more severe form, that is osteochondral defect can occur. Osteochondral bone formation defect can occur. As we see here, the cartilage damage and there is a osteochondral changes. That is the bone also says early erosion. Okay. So once this erosion may be more severe, then osteoarthritis changes will be progressive. Okay. So this is a more marked osteoarthritis changes with there is a subchondral changes, erosions. To conclude, imaging played a major role in the early detection of intra-articular structure, but if cartilage, menisci, and articular margin. Okay, how the articular margin, whether it's normal or sclerosed margin or cartilage mapping, joint capsule, that capsule, how the capsule and bone, this will be can very precisely we can demonstrate in MR imaging, and will be help the patient by doing interact with the clinical colleagues of orthopedic surgeon. So detection of early changes of the joint, surrounding tissue, allow the particularly how the bone, surrounding bone, how the muscles, and this and start the curative therapy on particular time, early stage. So it is halting the course of the disease process and reducing the socio-economic impact of osteoarthritis changes. Thank you very much for your attention. Any questions? You can interact with me or after that. Yeah, thank you very much.
Thank you so much, Doctor. So next up, I'd like to invite Dr. Navaladi Shankar for his address.
Tissue with the cartilage tissue. That's an idea of getting this joint preservation piece. So, Dr. Chidambaranathan was told about the cartilage mapping and other things. You know, actually cartilage is a tough structure in all the joints, but it gets damaged, maybe because of the inflammation, because of the disease, because of the infection. So once it gets damaged, don't need to go for replacement. We have to restore. So this is just microscopic how our cartilage looks. So we have to replace. So how we do is now the latest is we take the patient's cartilage, we grow the cartilage outside, and then we put it back. That's called cartilage transplant. That's just preserving the joint so that patient has his own cartilage so that they can go back to normal activities. That's a basic idea. So There's imaging limitations. He showed about the MRI. So arthroscopy is one of the best way to get this diagnosis, get the early diagnosis, and then you know what is the type of cartilage lesions, and then treat it. So there are many options, usually divided into three. Maybe you do an arthroscopy, find out if it's an alignment problem, you do the osteotomy, align it, and if it's a severe cartilage issue, you have to treat the cartilage. So I'll stop here because more and more people will explain as the various options available. Like our own blood can be used to preserve the joint, our own bone marrow can be used to preserve the joint, our fat cells can be used to preserve the joints. So all this, we are talking about young people, maybe post-stroke, sports injury, 20 years age or 30 years age when they have an early arthritis. So this is the age group where we have to get the diagnosis early and treat so that they preserve the joint. That's the basic idea is Apollo, we started this program, we preserve the joint at this younger age. Thank you.
In the CME, my role is to talk about, suppose it does get to a stage where the cartilage is worn out and is joint replacement is the only option. So in that CME, my role is to talk about alternative options to replace the joint, such as we mentioned here that there may be not the entire joint worn out of cartilage, there may be only a part of the joint where the cartilage is missing, the rest of the ligaments and soft tissues are good for the joint. In that scenario, we don't have to necessarily replace it with metal. Yes, we may have options. One of the options we have is taking cartilage from the same joint and then culturing it and then filling the small area where the cartilage is defective, fill it with the lab-grown cartilage cells. Now it's a billion-dollar research, this cartilage defect and how to replace it worldwide. We've still not mastered it, but we have multiple techniques at our disposal now to repair and replace the cartilage in case the defect is small, not bad enough to need the entire joint to be replaced. So later on, I'll be talking about what's called regrow or cartilage for cartilage, taking cartilage cells, culturing it, and then filling the defect. Now broadly, I look at, when it comes to knees, there are ones which are mechanically aligned and the ones which are bent. When people come too late, then yes, joint replacement could be the only option. The challenge is when the knee is painful, but it's aligned, the X-ray is not too bad, and how do we deal with those situations? That's when a lot of these joint preservation techniques are useful, such as the BMAC, the PRP, and then lab-grown cartilage cells to fill the defect, followed by physiotherapy. We also have options whereby even when the knee is slightly bent, we can fill the defect with cartilage cells and then correct the alignment of the knee without actually replacing it. So the entire CME this afternoon is going to be going through various stages of osteoarthritis, and also to emphasize not all joint pain is arthritis and not all arthritis needs joint replacement. Thank you very much for all your presence, and as I said, much in detail will be discussed about the joint preservation program at the Apollo Institute of Orthopaedics at Chennai, Greens Road, as well as the various techniques we all use as a team and the rehab techniques by the physiotherapists. Thank you.
I did do my backup work of thinking what it can help, and I just immediately to go to what the Pace Foundation, MRF Pace Foundation is all about, nurturing the fast bowlers for the country. That's what we do. And so basically, just want to take you into a little bit more cricket. Any fast bowler, when he runs from the run up and he delivers the ball on the crease, sort of loses 7 times of his weight goes onto his legs, basically onto every delivery. 7 times of his weight is huge. And he's not putting only one ball, he's going to bowl many overs and things like that. So when I was thinking about joint and things like that, it starts from the ankle, moves on to the knee, then probably the glutes, hamstring, and the basically affected areas, the fastest, where it happens. So I was thinking about this program. So if any of the boy has got some kind of a niggle, we call it, so, or any pain, so this program can be useful for them so that they can be diagnosed at the early, given a rehab program, and ready to play will be much faster. Then he injures himself, gets into a surgery, and then does a rehab, and then get into it. So in that way, I thought the joint preservation program could be very useful for any sportsman. Not I'm just talking about cricket, because I'm with cricket, so I'm just talking on basis of fast bowling, how we get into this. So that, in that way, so this program going to be useful to any sports person. I think I was just talking about a lot of arthritis and things like that, and the last doctor touched about the sports. I was just thinking, what am I going to do about sports? So he touched, and thank you for that. And in general, sports. And to be very frank, we even in BCCI, we go send the boys to any kind of a surgery done abroad and things like that. So I think Apollo will note on this. I think we are the pioneer in India. So plus we also have some work done from Apollo Hospital. All of our boys get to, all of trainees means we have about 30 trainees throughout India. So we have them all your DEXA and blood test and all the other so many number of tests that we do. Health check and things like that. So we do all that with Apollo as well. So now this program, I was just thinking how it can help us the next stage. So I thought the preservation, joint preservation could be very good. And if anybody is coming and this program is kicking off, I think we should utilize your services on this. So this is what I was feeling. And thank you very much for calling for this program. And I wish the joint preservation takes it to the next level. I wish the BCCI doesn't have to send anybody abroad for any kind of surgery in future. Thank you.
30s. 60% of young athletes experience knee pain due to high-impact sports and intense training with little recovery. Meanwhile, 67% of corporate professionals
have a big round of applause. Launching the Apollo Joint Preservation Program.
Your movement deserves more than just a quick fix. It deserves science-backed, expert-driven care. Welcome to Apollo's Joint Preservation Program, where science meets movement and mobility meets longevity. Unlike conventional treatments that only address symptoms, our approach is comprehensive. Regenerative medicine. Heal naturally with cutting-edge treatments. Orthobiologic therapy. Advanced solutions for joint repair. Minimally invasive surgical interventions. Restore mobility. Avoid major surgery.
This, as you was talking about the early preservation is, whenever there is a cartilage injury, it may be because of the sports, or maybe a simple fall at younger age, or maybe a 30-year-old thin female patients having anterior knee pain. The knee patella cartilage gets damaged. So if you lift alone, it will go for arthritis. So what the special technique is, we take the cartilage cells and we have a lab where we send to the lab and grow the cartilage cells. So once we grow the cartilage cells, we can bring back, and whatever the damaged cartilage is there, we can remove it and put this patient's own cells, own live cartilage cells. That's the biggest advantage. There's no metal in it. It's just a natural joint. So you go back to all your activities when you have a natural joint. That means you're trying to preserve the natural joint by growing the cells in the lab. That means your own cells. And immunologically, or there is no side effect because it's your own cells.
Lab is in Apollo.
labs in Pune, not in Apollo Hospital. So we send it to the lab in Pune. So that's cartilage cells growing is one of the treatment of the cartilage transplant. And many other options are also available, depends upon the diagnosis.